They found him, alone, slumped forward in his recliner. No signs of injury. No cry for help. Just silence. The TV was still glowing. His robe still slightly open. And in the room, there was this emptiness. The kind that settles in after something irreversible. The autopsy? It listed natural causes. But those of us who've seen this before, we know better. This wasn't just nature taking its course. It was something much quieter. Much slower. A silent hormonal collapse. The gradual unraveling of a man's strength, his presence, his vitality. Not because of disease, but because of neglect. And he's not the only one. Every year, thousands of older men follow the same path. Losing their edge, their drive, their clarity. Thinking it's just part of getting old. But what if I told you, it's not? What if I told you that something you stopped doing, something you were taught to give up decades ago, could actually be the reason for this decline? Let's talk about it. Because this conversation, it matters more than you've been told. A dangerous lie we've been taught. For generations, men have been told that self-pleasure is shameful, immature, unnecessary, especially after a certain age. Real men don't need it. It's just something for younger guys. You should grow out of that. Sound familiar? But here's the truth no one says aloud. Giving up masturbation, especially in your later years, doesn't just pause your sexuality. It starts a slow, painful decline that can quietly cost you everything. Your prostate begins to stagnate. Your testosterone plummets. Your emotions dull. Your sense of vitality, your sense of being alive, starts to fade. And by the time the signs show up, you're already years behind. I'm Dr. Mohit Kara, board-certified urologist, men's health specialist. For decades of experience working with men just like you. Men who built families, fought wars, raised children. Men who thought they were doing the respectable thing by giving up something they didn't think they needed anymore. And I've watched the regret in their eyes when they finally realized they'd been misled. But here's the good news. You can prevent this. And you can start today. In this video, I'm going to walk you through the 4 real health consequences that can happen when you stop masturbating as you age. And more importantly, how to protect yourself. These are simple, science-backed steps that thousands of my patients have used to maintain their health, their confidence, and their independence. Stay with me to the end. Because that final consequence? It's the one even doctors rarely mention. But it could quietly triple your risk of prostate problems if left unchecked. If you're watching right now, let me know you're here. Type a 1 in the comments if you're with me. Type a 0 if you're skeptical. I welcome both, because this conversation is long overdue. Consequence number 1, erectile decline. Let's start with the first consequence. And it's one I see all too often. A man, late 60s or early 70s, walks into my office. He's confused, frustrated, maybe even a little scared. "Doc," he says, "I haven't had a spontaneous erection in months. Maybe a year. It's like it just stopped." And here's the thing. It didn't happen all at once. But to him, it felt like it did. One day he was himself. And the next? Something inside just shut down. No warning. No red flag. Just silence. You want to know why? Because no one ever told him this simple truth. Your penis isn't just for pleasure. It's a functional organ. And just like any other organ, it needs blood flow, oxygen, and use to stay healthy. When you stop using it, when you go months without stimulation, the tissues begin to degrade. Blood flow slows. Oxygen drops. Nerves start to dull. And over time, the tissues stiffen. Not in a good way, but in a way that leads to fibrosis, to nerve damage, to irreversible erectile loss. It's like a muscle that's never exercised. You don't just lose strength, you lose function. And worst of all, there's no alarm bell. No danger light. It's quiet. Gradual. You just wake up one day. And it's gone. I've had grown men in my office, eyes glassy, asking, "Doc, can I get it back?" And sometimes, with time and effort, yes, they can. But not always. Some men wait too long. And by the time they act, the damage is done. Because they thought quitting masturbation was harmless. That it was discipline. But the truth is, it was the beginning of decay. And hear me clearly. This isn't about being obsessed with sex. This is about preserving your vascular health, your hormonal health, your sense of being a man. Even just once or twice a week. A simple routine can keep the blood moving, keep the nerves firing, keep the system alive. What you don't use, you lose. And when it comes to your body, that loss can be permanent. Consequence number 2, testosterone collapse. Now, let's go deeper. Because while erectile decline is bad, there's something even more devastating that happens when you give up self-pleasure in older age. Your hormones crash. It starts subtly. You don't feel like yourself. You lose interest in morning routines. You're more tired, less motivated, snapping at small things, feeling flat. Your doctor says it's just age. But I'm here to tell you, it's not just that. It's your testosterone. And it's dropping faster than it should. And here's the part most men never hear. Masturbation is one of the few non-pharmaceutical ways to stimulate natural testosterone in older men. When you engage in arousal and release, your brain sends a powerful cascade of signals to your endocrine system. Dopamine spikes. The hypothalamus wakes up. Your testicles get the message, "Hey, stay online. We still need you." But when you stop all sexual activity, no stimulation, no release, your body assumes it's no longer necessary. So it scales down testosterone production. And that's when the spiral begins. You're not just tired. You start losing your sense of self. You lose muscle mass. Bone density drops. Mood gets darker. Cognition slows down. Even your risk of heart disease and stroke increases. I had a patient, a retired firefighter. Strong guy. Full of pride. He came in after months of not feeling like himself. And when we tested his levels, his testosterone had cratered. He looked at me and said, "Doc, I don't even recognize the man in the mirror." That wasn't vanity. That was grief. Grief over something that could have been preserved. With a simple, private, healthy practice. And here's the hard truth. Once your hormones crash, it's a long, expensive climb back up, if you can get them back at all. But a few minutes a week of intentional stimulation? That's often all it takes to maintain healthy hormonal rhythm. Not indulgence. Not obsession. Maintenance. And while you can't see hormones, you feel them. In every cell of your body. But what comes next? That's something men do feel. Every day. And it hits closer than you might expect. So far, we've talked about how giving up masturbation in older age can quietly dismantle a man's vitality. From erectile decline to hormonal collapse. But there's another layer to this story. And this next consequence? It doesn't just take away your strength or your energy. It brings discomfort, pressure, even pain. Right in the part of your body you probably haven't thought much about until now. Let's talk about the prostate. Consequence number 3, prostate congestion. There's a kind of discomfort that sneaks up on older men. It starts small. A dull ache in the pelvis. A little pressure after you sit too long. A nagging sense that you need to pee, even when you don't. It's not sharp, not dramatic, but it's there. You shift in your chair. Wake up a couple times at night. Maybe you start going to the bathroom more often than you used to. You chalk it up to aging. You ignore it. Until one day, it's too much to ignore. And by the time most men finally bring it up with their doctor, they've been living with it for months. Sometimes years. And here's the shocking part. In so many of these cases, the culprit isn't bladder trouble. It's prostate congestion. Yes. Congestion. Just like traffic. Because here's something no one ever tells older men. Your prostate is an active gland. It produces and stores seminal fluid that's meant to move, to leave the body. But when you stop all sexual activity, no sex, no ejaculation, no release, that fluid just sits. And when it sits, it thickens, it hardens, it builds pressure. And that's when inflammation begins. That's when discomfort sets in. That's when your body starts sending quiet, but persistent, warning signals. And this isn't just about feeling uncomfortable. It's about your quality of life. It's about your sleep, your movement, your ability to relax and focus. One man told me, "Doc, I haven't slept through the night in over a year. I get up 3-4 times to pee. And I still feel like I didn't go." We ran the tests. Bladder? Fine. But his prostate? Congested. Inflamed. Crying out for relief. And the treatment? Not drugs. Not surgery. Movement. Release. Because that's how the male body is designed to regulate the prostate. Through ejaculation. And when that process is ignored, the backup begins. And with it, a whole series of complications. The risks get worse. You've probably heard of chronic prostatitis. A painful, long-term inflammation of the prostate. Hard to treat. Even harder to live with. But here's what you may not have heard. There's a connection between prostate stagnation and increased cancer risk. That's right. Multiple studies, including one out of Harvard, have found that regular ejaculation may help lower the risk of prostate cancer. Why? Because when the prostate is regularly emptied, you reduce the buildup of potentially harmful compounds. You keep the system clean, functioning, balanced. But when that fluid sits, month after month, year after year, you create the perfect environment for inflammation to take root. And chronic inflammation is the first step toward something far more dangerous. I had one patient, early 70s, who came in for a routine check. No sexual activity in over 2 years. Didn't think he needed it. Felt like that part of his life was behind him. But his PSA levels were spiking. Further scans revealed significant swelling. And suddenly, he was facing a biopsy. All because a perfectly natural, healthy function had been ignored. You see, we've spent so much time telling men not to focus on sexual health that we forgot to remind them. It's not about pleasure. It's about protection. Protection of one of the most vulnerable organs in an aging man's body. Your prostate isn't optional. It doesn't stop working just because your desire fades. And when you stop caring for it, the damage is very real. Now here's where this gets even more personal. Because pain, discomfort, medical scares, those are hard enough. But the final consequence? It hits deeper. It strikes not at the body, but at the very core of how a man feels about himself. And too often, he never sees it coming. Until it's already there. Consequence number 4, emotional disconnection and loss of self. This is the one that hurts to talk about. Because it's so quiet. So slow. And so misunderstood. But I see it every day. A man stops masturbating. Not because he's sick. Not because of religious guilt. Sometimes, not even by choice. He just stops. Maybe he thinks it's time. Maybe he's single. Maybe he's embarrassed. He tells himself it doesn't matter. But over the weeks and months that follow, something changes. He doesn't smile as much. He stops looking in mirrors. He sleeps more. Or sleeps less. His appetite dulls. He begins to feel invisible. Not because others ignore him, but because he's disconnected from himself. You see, what most men don't realize is that self-pleasure isn't just about arousal or release. It's about recognition. It's about feeling alive. Feeling human. Feeling connected to your own body. And when you take that away, especially as you age, you cut off one of the final, private threads between your body and your spirit. I had a man, mid-60s, strong history of service, Navy vet. He told me, "Doc, I haven't touched myself in over a year." I didn't think I needed it anymore. But as we talked longer, he admitted something else. "I feel hollow. Like there's a piece of me missing. And I don't know how to get it back." That hit me. Because that man wasn't talking about sex. He was talking about identity. About a quiet kind of grief that too many men carry. The kind that doesn't show up in lab results, but shows up in the way you carry your shoulders. In the way you answer, "How are you?" In the way your eyes avoid meeting your own in the mirror. This isn't psychological fluff. This is science. Neurologically, the chemicals released during masturbation. Dopamine. Oxytocin. Endorphins. They're vital. They regulate your mood. Reduce stress. Strengthen emotional stability. Without them, men are more likely to feel anxious, withdrawn, even depressed. And here's the terrifying part. Most men never realize what caused it. They don't connect the dots. They don't see that the numbness, the low-grade sadness, the apathy, started when they stopped honoring this part of their life. And by the time they do, the damage is deep. The real cost of silence. This is the consequence that breaks my heart. Because it doesn't just take away function. It takes away dignity. It takes away warmth, tenderness, curiosity. That small, essential voice that says, "I matter." And it replaces it with silence. But hear me now. It does not have to stay that way. Because I've seen the transformation. And it doesn't take a miracle. It takes something far simpler. A willingness to reconnect. With yourself. With your body. With your needs. Even the ones no one ever gave you permission to have. This isn't about lust. It's not about obsession. It's about life. It's about remembering that even now, even at 60, 70, or beyond, your body is still yours. It still longs to feel, to express, to connect. And you still deserve that. So here we are. You've heard what happens when older men stop masturbating. You've heard the truth that most doctors won't say out loud. About sexual function fading quietly. Testosterone crashing without warning. The prostate backing up like a clogged pipe. And worst of all, the silent grief of disconnection. But here's the most important part. It's not too late. Not even close. And in this final section, I'm going to show you exactly how to come back to yourself. With practical, research-backed steps that you can start today. Not next week. Not next year. Now. Because you deserve that. Let's finish this together. Step 1. Redefine what self-pleasure means. First things first. You need to take a deep breath. And let go of everything you were taught about this topic. Forget the shame. Forget the jokes. Forget the idea that it's immature or only for young men. None of that was ever true. Masturbation, at its core, is body maintenance. It's nervous system regulation. Hormone support. Emotional reconnection. It's the male version of charging the battery. And the moment you stop seeing it as a weakness or a vice, and start seeing it as an act of care, is the moment your healing begins. I tell my patients all the time, this isn't about getting off. It's about checking in. With yourself. With your energy. With your ability to feel. That reframe alone is powerful. Step 2. Start with gentle frequency. Now, I'm not telling you to dive into some kind of routine schedule like you're 25 again. That's not the goal. The goal is reintroduction. Start simple. Once a week. Maybe twice. That's all your body needs at first to remember. Oh yeah, we still do this. We still care. Don't force it. Don't chase a goal. Just give yourself permission to experience. Without judgment. Without urgency. And if it's been a long time, you might notice some resistance. Emotionally. Physically. Mentally. That's okay. That's normal. You're not broken. You're waking up again. So treat this practice the way you treat physical therapy after an injury. Slow. Respectful. Consistent. And let your body tell you what it needs. Step 3. Choose the right environment. This may sound obvious, but it matters more than you think. Set the mood. Not for excitement, but for presence. Turn off distractions. Put your phone away. Dim the lights. Create a space that feels safe. Because especially for older men who've disconnected from this part of themselves, the environment needs to say, you're allowed to feel. You're allowed to relax. And here's the secret. This isn't just about making the experience pleasant. It's about rewiring your nervous system to associate pleasure with peace. Not guilt. Not fear. But peace. And when that rewiring happens, everything starts to shift. Your mood. Your hormones. Your clarity. You don't just feel good in the moment. You feel better days later. Step 4. Pay attention to your body's feedback. As you begin to engage again, your body will talk to you. Not in words, but in sensation. Energy. Emotion. You might notice morning erections returning. A spark of interest in your partner. A deeper breath. More energy during the day. Even better sleep. These aren't coincidences. These are signs that the lights are turning back on. One patient of mine, his name's John, 71 years old, told me, "Doc, I started with once a week. Just a quiet moment, nothing fancy. After 3 weeks, I started sleeping through the night again. I feel steadier." That's the magic of natural rhythm. It doesn't demand a performance. It just responds to attention. And as your body gets back into sync, you'll feel it. In your bones. In your breath. In your step. That's not vanity. That's vitality. Step 5. Honor the emotional side. This step is the one most men skip. Because physical stimulation? That's the easy part. But emotional presence? That takes courage. It means letting yourself feel. Letting yourself be vulnerable. Letting yourself be tender. Even if no one else is watching. You see, most men grew up in a world where touch had to mean sex. Where arousal meant urgency. But here, now, in this season of life, it can mean something deeper. Connection. Comfort. Gratitude for a body that still works. That still wants to feel alive. So if emotion comes up during this process, let it. Tears? Let them fall. Joy? Let it fill you. Grief? Let it pass through. This is your sacred time. To reconnect with you. And trust me, That emotional openness? It doesn't make you soft. It makes you stronger than ever. Step 6. Celebrate the wins. If you notice even the smallest improvement, celebrate it. Not with a trophy, but with a simple acknowledgement. I'm coming back to myself. Because when you do this consistently, you'll start to notice things that seemed impossible before. Morning energy. A clearer mind. Interest in connection. Desire that feels honest and unforced. A deeper sense of being present. And every one of those things is worth celebrating. Because you earned it. You chose to care. You chose to listen. You chose to stop believing the lie that men are supposed to disappear after 60. And that is powerful. The bigger picture. This isn't just about masturbation. This is about taking back your role in your own health. Because too many men are waiting for someone else. A doctor. A medication. A partner. To save them. But what if that power was always in your hands? What if all it took was permission? Permission to feel. Permission to explore. Permission to want more out of life. You don't need to be perfect. You just need to be present. And from that presence comes everything you thought you'd lost. You're not alone. If this message is hitting something inside you right now, good. It means you're still in the game. Still alive. Still willing to fight for yourself. And if you've made it this far, let me say this directly. You are not alone. There are thousands of men just like you, wrestling with the same questions, the same shame, the same hope. And they deserve to know that there's another way. That health doesn't have to mean silence. That masculinity doesn't disappear with age. That pleasure and dignity can walk hand in hand. So if you're with me, if this message resonates, let's take a stand together. Final words. There's a belief floating around that intimacy, pleasure, desire are things you grow out of. That after a certain age, your body's supposed to go quiet. That it's dignified to give it all up. But I'm here to tell you, that belief is wrong. It's old. It's broken. And it's costing men their lives. Because when you give up connection, you give up vitality. And when you give up vitality, you start to vanish. But you're not meant to vanish. You're meant to expand. To grow deeper. Wiser. More connected to yourself than ever before. And that journey? It starts here. With one quiet decision. I still matter. I still want to feel. And I'm not done yet. You still have so much left to live. So much left to give. And a body that, with the right care, will rise to meet you. Not with fireworks, but with a steady flame. So give yourself that chance. Not because you should, but because you can. And if this message meant something to you, if you're ready to begin again, let me know. Type 1 in the comments. Let me know you're with me. That you're still here. Still learning. Still fighting for yourself. And if you're unsure, that's okay too. Type 0 and ask your questions. I'll answer them. I'm here for you. And if you want to help other men hear this message, hit the like button. It helps more than you know. And don't forget to subscribe. Because this channel is for you. For men who refuse to fade. And if you'd like to support our work, there's a donation link below. Every bit helps us keep spreading these honest, unfiltered truths to the men who need them most. So stay strong. Stay curious. And above all, stay proud of the man you still are.